Hello, Accorda, and welcome to Labour of Love with me, Síomha O'Rourke, where we cut through all of the unsolicited advice and all of that information online, and we're going to find out what we actually need to know. This is a podcast for hopefully all and every pregnant person out there, whether you're on your first, your second, your third, or if you're just starting to think about it. Hopefully there'll be something for everyone to learn. I am currently 31 weeks pregnant and I'm feeling it. I can't lie. I'm definitely feeling it. The change I've noticed this week is my sleep has started to become affected, which is really annoying. And I naively thought that I wouldn't get the third trimester insomnia, but it's starting to creep in now. I have kicked the husband out of the bed a couple of times, which has helped, but we'll see how we get on the next few weeks. What I don't understand though is we are literally just about to introduce into our lives one of the most notorious sleep disrupting devices in the world, and now our bodies decide to get insomnia. Could evolution not have had a chat with the hedgehogs maybe and said hibernation's great this time in your life? You know, I would like to be awake for 6 hours and asleep for 18. That sounds good to me. So Charles Darwin, call me. I want to chat. We will chat about sleep in a future episode, but this week's episode is all about food. And if you're anything like me even just saying the word food has made you hungry. So we are going to talk about all the changes that happened. Now, for me personally, I didn't have a huge amount of changes in my appetite in the first 2 trimesters. I was very lucky in that I didn't get morning sickness. So I will absolutely recognise my privilege there in that I could kind of keep enjoying my food. I am now a breakfast eater where I never was before, and it's true what they say, it truly is the best meal of the day, which I'm loving. And also my stomach is definitely getting smaller now that I'm in the 3rd trimester. Baby's getting bigger, other organs are having to suffer, and I'm getting fuller quicker. So I could be stuffed, couldn't have another bite of my dinner, and then 30 minutes later I'm like, when's the next course? Which I'm not complaining about. That is another meal to add to my day, which is always enjoyable. Cravings wise, I'm extremely suggestible. So I dog sat for my parents recently, and one of them is a little diva and she won't have normal dog food. She'll only eat Weetabix. So I was smushing up Weetabix in with processed ham, okay? Sliced up processed ham and mashed up Weetabix. Bear in mind, I'm a vegetarian. I should not have found this appealing. Nobody should have found this appealing, in fact. But there I was on my way to Tesco to buy a family pack of Weetabix, which I inhaled for the following week. So you just never know, okay? If you hear about food, if you see food when you're pregnant, you're going to want to eat it. And I'm looking forward to discussing that and a whole lot of other things with today's guest. I'm going to be joined today by the lovely Jess Willow, who is a women's health expert and a fertility and pregnancy dietitian. And she's brought a very special guest along with her. So let's go ahead and meet Jess and Maisy. Okay, Jess, thank you so much for coming on to Labour of Love. And before we get into the questions, I'm going to address the tiny little gorgeous elephant in the room because we have a visitor with us today.
We do. Yes, we do. I have brought my 4-month-old Maisy along with me. She's my +1 for the day. So thank you very much for welcoming her in today as well.
I'm delighted to have her. Delighted. So if anyone hears any mewing or anything during the episode, it's Maisy, okay? She may join at some point as well.
Possibly will. Oh,
there she is.
Yeah.
Right on cue.
Yeah.
And here she is. She's joined us already. Little diva.
She doesn't want to.
She saw a camera.
Yeah.
She saw a camera and she said, I want in.
Yeah, she loves it. She loves it.
So the conversation I want to have today, Jess, I really want to remove a lot of the guilt that we feel because there's so much guilt already out there for what we should or shouldn't be doing. And I want to focus more on the do's than on the don'ts. I want to first start about how we can start preparing our bodies for pregnancy. I, at the grand old age of 32, was still a little surprised when I found out I was pregnant. It happens. But for those who have the kind of wherewithal to plan ahead of time, what should they be doing to prepare their body for pregnancy?
Yeah, really, really good question. And I think, a lot of pregnancies are unplanned or untimed, and it's very hard to know exactly when you are going to get pregnant, even if you are trying. Ideally, we want to give ourselves a minimum of 3 months preparation time for women and men. I think we can't forget the boys in this because generally it is 50-50. And really kind of that's the timeline that we see any dietary changes, any lifestyle changes having an impact on our egg quality. And it's about 2.5 months for any dietary and lifestyle changes to have an impact on sperm health and quality as well. So really kind of looking at making sure that we're getting a good nutrition plan, supplement plan in place, and really that we're looking at kind of a lot of the lifestyle factors which may be negatively impacting on our fertility health. One thing that I always say to ladies, clients, irrespective of if you're trying to conceive or not, is that any woman of a childbearing age who is sexually active or maybe sexually active should be taking folic acid. We know, I think, a lot around the importance of folic acid, around the reduction of the incidence of neural tube defects in the developing fetus. A lot of the time, we don't know we're pregnant, or it might not be planned. So even if you're not trying to plan to get pregnant, I think taking folic acid is really, really important. Really cheap supplement to take. 400 micrograms is what's recommended. You can get it in any supermarket. Other than that, then we'd be looking at things like making sure that we're optimizing our nutrition as much as possible. When we do get pregnant, baby takes priority, and it can often be mum that then ends up being depleted nutritionally. So if we have a really good solid foundation of really kind of balanced nutrition, optimizing our nutrition, not cutting things out but adding things in, then we're kind of loading up really on essential nutrients to make sure that we have the reserves there for when we do hopefully get pregnant. We would also look at kind of ideally getting background blood work checked. Again, doesn't always happen, but it's something that I would talk to a lot of my prenatal clients about, kind of looking at hormonal bloods and some nutritional bloods as well that we would be looking at getting checked, that again can become depleted once we are pregnant, or also may impact on the ability to get pregnant and stay pregnant. So things like vitamin D, B12, folate and ferritin. So kind of the folate and the ferritin, the B12 kind of linked to different types of anemia, or, you know, kind of building up the ferritin, which is the store cupboard of our iron stores, which can become depleted during pregnancy. And then vitamin D, again, in Ireland, sunshine issue. A lot of us are insufficient in vitamin D, and also we like to see a slightly higher blood level of vitamin D in women who are trying to conceive or who are pregnant than of the general population. So even if you do take, you know, your kind of standard vitamin D supplement, you might still be insufficient in regards to your vitamin D levels in the blood.
Right.
So getting those checked, and then we can tweak the dosage of the vitamin D required in addition to that. So that's something that we'd really be looking at. The other things that we'd be looking at is obviously things like alcohol. Definitely as we get slightly older, us women, and our egg quality starts to decline, and we know that alcohol is a toxin, so it can really negatively impact on our egg quality. Then we would obviously look at things like smoking, vaping, recreational drug use, and some other medications which may not be suitable in pregnancy, and that would be obviously something to discuss with your doctor.
Of course, yeah. Okay. And so what about, I actually saw on your Instagram page that you had advice for people who are undergoing fertility treatment, such as IVF. Would your advice for them be any different?
Yeah, so I work with a lot of clients who are at varying stages of their fertility journey, and ones who are indeed navigating the journey of fertility treatment. So yes, it would differ a little bit depending on the reason why they're having fertility treatment. So is it because we know that there's a condition underlying with either the male or the female partner if it's a heterosexual couple? So it might be that there is endometriosis present, or polycystic ovary syndrome, or there's autoimmune conditions, in which case we'd obviously be trying to focus on kind of managing those conditions, and making sure we're kind of optimizing the management of those in order to get pregnant. If they're doing something like, you know, freezing embryos or freezing eggs, we'd obviously be focusing really on egg quality with the woman. If it is egg freezing, if it's embryo freezing, we'd be looking at sperm and egg health. And we do have more research in regards to certain supplementation and kind of really targeted supplementation in relation to sperm health in particular, which is really receptive to nutritional changes and supplemental changes. And obviously we're going to be testing the sperm health, whereas if you're trying naturally, the majority of people aren't testing the sperm health or, you know, anything like that before we get pregnant. We don't have a test to look at egg quality, but we would look at the hormones and kind of look at menstrual cyclicity and things like that. And then if somebody is looking at something like a frozen embryo transfer, so we're looking at transferring an embryo, either fresh or frozen, there are more kind of targeted approaches, and so the timing might be different in regards to looking at the blood flow to the uterine environment, looking at the vaginal microbiome, which we're learning a lot more about, and also some kind of novel foods or supplements that might help thicken the endometrial lining to make sure that there's a nice bed there for the embryo to kind of cozy into. So you might not be as focused on that if you're trying naturally, because you don't kind of have that different staged approach. Whereas when it is fertility treatment, you might have kind of more of segregated stages where you're focusing on the egg collection, then you're focusing on the transfer, then you're focusing on that kind of 2-week wait where you're waiting to see if it's been successful.
And I love that you're bringing the men into it as well, because it is obviously a 50-50 job when it comes to it, you know. Let's talk about nausea and morning sickness, because the first trimester can be so tough for so many people with nausea, not to mention those going through hyperemesis, with people who just struggle to keep food down. If you're struggling to keep food down in your first trimester, what kind of foods should we be prioritising?
Yeah, and my heart goes out to any woman who has experienced nausea, hyperemesis, morning sickness, any of those types of symptoms. And obviously hyperemesis is that, clinical condition of extreme sickness throughout, generally throughout first trimester, but unfortunately some women can experience it further into pregnancy as well. So obviously if it is like, you're kind of feeling nauseated at certain times of the day, it's really kind of listening to your gut and going with what you can manage at that time. It kind of goes back to why that prenatal period is so important, because you're setting down the foundations and the reserves there for if, obviously you do struggle to get nutrition in at any stage in your pregnancy. If you've been quite well nourished and got the right nutrition in prior, I guess you're a little bit more, I guess there's a little bit more reserve there. So a lot of women will crave kind of plain carbohydrate foods, toast with butter on it, crisps, chips. I've had women who have craved yogurt and fruit. I've had, it tends to be vegetables and fruit, fish, meat and eggs, and sometimes dairy that kind of people tend to go off. So what I would say is little and often. I think a lot of the time you'll have your partner or the mother-in-law or whoever it may be slapping a big roast dinner down in front of you, and my gosh, that is going to be the most off-putting thing you could put in front of somebody who has any type of nausea in the first trimester. So it might look like 5 to 6 small little snack type meals instead, which can be challenging if you're feeling nauseated, but it could just be some crackers and a bit of cheese. It could be a glass of milk, really, really nourishing. It could be something like, if you find milk and yogurt okay, can you make a smoothie and blend in some fruit and veggies into it to get a bit more nourishment in that. Sometimes people are okay with soup, but might not be okay with kind of like a vegetable stew, for example. So it really is kind of thinking about what you can manage and then how you can kind of try and optimize it a little bit. If people are really struggling to get in kind of certain nutrients, we'd obviously look at, making sure your supplementation is in place and that we can try and kind of negate any possible issues if you are struggling. But a lot of it is reassurance for mum, and just, I guess, reassuring that it generally is temporary. You will, baby will be fine. It might be mum that gets a little bit depleted in things, and we can try and build that up once you can eat again or manage a little bit more. If it is quite severe sickness, something like hyperemesis, get to your GP, get to your maternity clinic. There is Caravan that is available now on prescription in Ireland, which wasn't available, I think, 2 or 3 years ago. There is a cost attached to it, which is a shame, but it is available, so that can be a massive thing. And just making sure that you're staying hydrated,
all the
really
time.
well hydrated is really, really
pregnancy.
important. Like milk is probably the best thing that you could be
Really?
drinking. Yeah,
Cow's
it's
milk?
really hydrating.
Okay.
You're getting calcium, you're getting protein, you're getting fats, you're getting vitamins and minerals. So anything milk based,
Maisy agrees.
Maisy agrees. Anything milk based will be really, really beneficial if you can get that in.
Okay, super. So actually, before we started recording, Jess, I was saying how it's so tough, how life just keeps marching on even when you're pregnant. I had all these kind of dreams of like home picked organic vegetables picked from my garden first thing in the morning. But of course, life came crashing down when I realised I still had to work full time, as do most women when they're pregnant. So obviously we want to be aware of nutrition, but we also have to be realistic about it.
Yeah, absolutely. And I think there's a lot of pressure that we ourselves as women put on ourselves, but also a lot of pressure in the media and social media in particular, and kind of this scaremongering around eating any food that is processed, which is really, really it's misinformation. It's not support, it's not helping anyone really in kind of trying to nourish ourselves, especially in the environment that we live in. And I think when it comes to organic food in particular, yes, we know that organic food, especially fruit and vegetables, are grown without pesticides, without a lot of chemicals, but also a lot of all the chemicals that are used in kind of, the EU are approved and are shown to be safe in regards to overall health. What I'd say to... Excuse me, Maisy. You're all right.
She's agreeing with her mother.
Yes, she is. She agrees on that. What I would say is, yes, ideally we want to be eating whole foods, and that's kind of, foods where not a lot has been done to them. but it's not always feasible, it's not practical, it's not realistic. So really kind of looking at, I guess, from an organic perspective, if you're buying fruit and vegetables that aren't organic, which most of us do, just making sure you're washing them, because then you're washing off any of the chemicals, any of the pesticides that have been used to preserve them. And, that's really as good as, and even if you are getting something that is, the pre-washed salad leaves or spinach, still wash them. I always still rinse them under the sink, just to make sure that you're, again, because they wash them, but they'll also have some chemicals in the water that they're using to try and preserve and keep the colour nice and fresh. So just give them a little rinse under the tap, and you're kind of rinsing a lot of any of the chemicals or pesticides that are used there. Another example that actually came to my mind when you asked that question is, I had a lady in clinic a few weeks ago, and she was pregnant on a plant-based diet through preference, and had been on for a long time. And she was using organic plant-based milk, which, obviously we think organic, that's going to be really, really good. But actually organic foods can't have any fortification. So they can't have any vitamins or minerals added to them. And obviously milk is our main source of calcium. And obviously if it's plant-based milk, we don't have calcium naturally added in. So as she was using an organic milk, there was nothing else added in, and her calcium intake was actually really, really low.
Really?
Yeah. And now once we went through it, she was really happy to swap to a non-organic variety, which is cheaper a lot of the time, and you're getting the calcium. You're also maybe getting iodine that's being added into plant-based milks, and some kind of, vitamin D if that's added in as well. So it's something to keep in mind that if you're looking at organic products and we're relying on some food products for fortification of vitamins and minerals, you're not going to be getting that there as well.
Oh my goodness, as an oat milk girlie, I'm going to have to check my cartons when I get home.
Check it out. If it's not organic, it likely is fortified.
No, I'm not that posh.
One to check.
So let's talk about cravings. I think before I was pregnant, I had this image in my mind that a craving meant you had to have it and you had to have it now. But you don't actually, like, it's kind of just a wave of desire that washes over you. But I have been prompted to crave ridiculous things if I hear about something, or if I read about something, or if I see something to tell you, I'm like, I need. I was actually reading an article about the listeria outbreak a few weeks ago, and I was reading it was kind of home cooked or ready meals, and one of them was chow mein, and I read this and I was like, all I want right now is a chow mein, which is a ridiculous thing to think. But we can overcome our cravings.
Yes. Okay. Well, I would have some concerns around that because, well, it depends on what's driving the craving. So often we are maybe craving certain foods because maybe we're needing a certain nutrient at that time. Like a really interesting one is when we are due our period, we often crave chocolate, but actually chocolate is quite rich in magnesium, and magnesium can help with, it's like anti-inflammatory and it's antioxidant. So often we're craving things like that because actually our body needs some anti-inflammatory foods, some antioxidant foods, which are going to help with those cramps that we get kind of around our period. Often again in pregnancy we may be craving certain foods because of the nutrients that we're needing. So maybe if you're craving salty crisps, you might be a little bit dehydrated and you need the salt there to replenish if you're drinking lots of fluids. And again, sometimes we would see cravings as being emotionally driven. So if we are tired, again, we're going to crave more refined foods that are going to give us a quick energy boost. Things like sugary foods or kind of, quite kind of like refined carbohydrate foods, because that's the quickest way we can get energy in. So if we're tired, that's going to give us an energy boost. And then other things like if it's emotionally driven. So maybe if we are stressed or anxious or sad, again, food can be an emotional crutch. It's a constant, and we do use food as a way to cope with our emotions a lot of the time. A certain amount of emotional eating is fine, and we would, a certain amount of emotional eating is fine, and we would look at that kind of in the intuitive eating framework, which I work a lot in. However, where we do feel that we are maybe losing, and I don't like using the word control, but where we're losing the capability of kind of managing that, where we're overeating or there's guilt or shame associated with that, then we would kind of maybe look at building up our emotional toolbox and managing with that. Often if we are craving certain foods and we are trying to ignore that craving or, I guess move away from it, it can cause, this kind of this binge restrict cycle, which we see. So where we're kind of restricting that food because we think it is bad. So yeah, when we're looking at kind of that binge restrict, if we're cutting out certain foods and we are feeling guilty for craving them or for eating them, it can lead to us then binging on that food, especially where we maybe don't have the best relationship with food. So I guess I've not really answered your question, but I guess I would be looking at the core root of maybe possibly why we're having that craving and not feeling guilty for giving into a craving or for allowing yourself to have certain foods, because it's not the foods that, you know, we want to be not cutting foods out, but we want to be looking at what foods we can add in.
Yeah, I suppose I have to kind of do a little bit of thinking myself out why I thought it was a good thing to overcome to be able to overcome cravings. You know, that's obviously from conditioning from over the years of diet culture. Let's move on and chat about supplements in terms of the usual antenatals and of course whatever your doctor suggests from your bloods. But actually, before we get into them, can I ask, is there a better time of day to take them, morning or night? Because I'm quite good at taking them, but if I fall out of the habit of taking the morning, I'll take it that evening and then be doing it at night time. And I'm just wondering, is there a better time of day to do it?
Yeah, so it depends on the type of supplement or nutrient that you're taking. So some nutrients are better to be taken with food, some are better to be taken without food, some are better in the morning, some are better in the evening. So it really depends. I guess if you're kind of looking at a standard prenatal or a multivitamin, morning time is better just because some of the B vitamins cause DNA You are. Come here to me. Some of the vitamins cause us to kind of, I guess it causes us to metabolize carbohydrates. So sometimes it can just wake you up a little bit, if that makes sense. Things like magnesium, which I think we mentioned when we were chatting prior to starting to record, is better in certain forms taken in the evenings because it's really good for stress management and for relaxation. So that's nicer in the evenings. If it is something like vitamin D or omega-3s, they're generally better taken with food because the fat in our food helps us absorb the nutrients. So it depends. And then we would be looking at certain nutrients and not overlapping them or taking them at the same time.
Oh, really?
Yeah.
Like what?
So if we are taking kind of high doses of minerals, so if you're on an iron supplement for iron deficiency anemia, for example, you don't really want to be taking that with a calcium supplement because they compete for absorption. So it just means that you're not getting your max absorption from taking those supplements.
Well, you should take iron with vitamin C, shouldn't
exactly.
you?
Yeah. Whereas exactly. So that's
former anemic girl over here.
Perfect. You know. So yes. And then other nutrients help us absorb other nutrients. So vitamin C and iron, vitamin D and calcium. So they work together as well. So yeah, I guess to answer your question, with a prenatal or a multivitamin, consistency is key. So if it is that, you just breakfast is a little bit, erratic, or you just can't get it in the mornings, but you're really good at taking it at dinner time all the time, then that's fine. That's better than not taking it. And I would do a lot of kind of supplement consults with clients as well, because it is an absolute minefield.
Yeah, oh, absolutely. And you mentioned a lot of the kind of supplements I think that most people would take during pregnancy. Aside from the obvious, like you mentioned folic acid, iron, vitamin D, are there any kind of pregnancy hero supplements that you would recommend?
Yeah, so I'm a big one for vitamin D. I bang on about vitamin D all of the time, and get, where possible, to get your vitamin D levels checked, as I've already mentioned. It's so important in so many different roles, not just with mum but also with baby. So it kind of acts like a hormone in our body, vitamin D, and so it supports, obviously our bone health. I think we all know that, but during pregnancy it's really important for bone and skeletal development for baby. It's really important for our immune function, and again, when you're pregnant, your immune function tends to be a little bit impaired, so really important to make sure you're getting enough vitamin D. It helps support the placenta, and it might reduce the risk of gestational diabetes and preeclampsia in pregnancy as well. So vitamin D is a big one. Generally there's quite a good dose of vitamin D in most prenatals, but again, like I've already said, if you don't know what your baseline is, you might need more than what's in your prenatal.
How many milligrams a day would you recommend of vitamin D then?
So the government recommend 10 micrograms, or it's gone up actually in the last couple of years. It was 10 micrograms. I believe it's 12.5 micrograms per day now for the general population, 10 to 12.5. However, I would probably recommend more based on the research that we have around fertility, around pregnancy, and the kind of importance of taking it during pregnancy, and also in breastfeeding as well. If women decide to breastfeed, your vitamin D requirements will be higher because you're passing a lot of that benefit onto baby, and then again, mum can tend to be depleted. So a minimum of 10 micrograms per day, but generally a lot of women would need more.
Right.
Another then of my kind of like supplements that I would look at, or kind of look and see if we're getting it through the diet, is omega-3. So a lot of us know about omega-3. So omega-3 is an essential fatty acids, EPA and DHA, which are kind of the two most common ones that we find kind of in regards to the importance in pregnancy. So DHA in particular has been shown to really help support babies' cognitive brain development, and also eye development as well. And also omega-3 acts like an anti-inflammatory in the body. So for in regards to our egg quality, omega-3 is really fantastic to make sure that we're getting enough in prior. So omega-3 would be one. And again, if you're getting fatty fish in, so that's like your salmon, mackerel, anchovies, sardines, herring and trout. Salmon tends to be the most common that we take in the Irish diet. If you're getting 1 to 2 portions of oily fish in per week, then you're getting sufficient amounts of omega-3.
Okay.
If you're not, for whatever reason that may be, we would recommend a supplement on top of.
So what if you're vegetarian? I'm vegetarian, so I would have no fish.
Okay. So you can get, so there's an omega-3s found in things like hemp, chia seeds, linseeds, flax seeds, walnuts. However, they contain an essential fatty acid called ALA, and only 10% of that ALA is converted to EPA and DHA. So we would say if anybody is on a vegetarian diet, that you would need to supplement with omega-3, EPA and DHA. You can get algae-based supplements, so seaweed-based, rather than a fish oil. Obviously, if you're vegetarian, that's not somewhere you want to go. And the algae-based supplements will have EPA and DHA added into them.
Okay.
Now, some maternity hospitals do recommend that you stop omega-3 at around 36 weeks gestation.
Okay, why is that?
The reason being is because it is, so we know a lot about omega-3 in regards to heart health. So it can thin the blood. So obviously from 36 weeks, there's a higher likelihood that you may go into spontaneous labour. We don't want to be on any blood thinning supplements or medication prior to that. So I would normally recommend that women are stopping it at around 36 weeks and then recommencing it post-baby, especially if you are breastfeeding again. Requirements are going to be higher because, again, you're passing a lot of that omega-3 onto baby, and mum can then end up sometimes being depleted. So yeah, a good algae-based EPA and DHA supplement would be recommended. My third then is choline. So this, again, is probably one that not a lot of people have heard of. So I think we all know kind of about vitamin D and omega-3, but choline it's not being classed as an essential nutrient yet. We call it a critical like nutrient. But it works with folate or folic acid to help reduce the likelihood of neural tube defects in the developing fetus when we do get pregnant. So absolutely so important. But also even prior to getting pregnant, choline helps with the DNA synthesis within the ATP of the cell. So it really helps with cell development and cell quality, and obviously our eggs are made up of cells, so really important from an egg quality perspective. We also see choline requirements increasing during pregnancy, so prenatal, and then they increase in pregnancy, and then they increase quite significantly again if women are deciding to breastfeed or are able to breastfeed. So it's something that I would talk to a lot of my clients about. The richest source of choline in our diet is offal, ironically, which is obviously not something that we want to be recommending that women of child, who are pregnant are eating because of the vitamin A content, and vitamin A can be toxic to the developing fetus. But we also find choline in red meat, in poultry, but eggs are a really rich source of choline. So I'm always banging on about eggs.
Okay.
And again, we find the choline in the yolk of the egg because sometimes, we might be using the egg whites because we think it's healthier. Yes. But I
love the bunny ears there.
Yeah, the bunny ears in there. So, but a lot of the nutritional benefit we find in the yolk of the egg. So if you're kind of including animal-based sources in your diet, then choline is generally not an issue. If somebody is on a plant-based diet or a vegetarian diet, whatever that might look like, where you're not including eggs, you're not including poultry or meat, then I would recommend a choline supplement on top of a lot of the prenatals that are available in the UK and Ireland do not contain sufficient amounts of choline as a supplement. They might throw in kind of 10 or 20 milligrams here and there. But actually, if we are not getting those animal-based sources in our diet, we likely need to be supplementing with at least 250 milligrams of choline a day.
I've never even heard of choline.
Yeah, a lot of people haven't.
I'm 6 months pregnant. I haven't heard of this hero supplement.
Oh, I hadn't heard of it before. I kind of did my fertility nutrition and started working in this area. America is obviously kind of a little bit more further ahead, and a lot of their prenatals will have sufficient amounts of choline in them now. We do now have some, I guess, choline requirements available kind of within the within Europe. So we are kind of guided by that. And I would say in the next few years, we will see it being classed as an essential nutrient.
Wow. Okay. How about then our pregnancy is progressing? Should the way we view food or should the way we're eating change as our pregnancy progresses?
I think we need to be a little bit more gentler on ourselves and maybe kind of just be a little bit more practical and realistic, and understanding that, okay, well, you can, rely on some processed foods that are absolutely fine to be including, and you might add some more veggies to them, or use frozen fruit and veg, and tinned beans, which are absolutely fine to be using as well. So I guess, as our pregnancy progresses, our nutritional requirements for certain nutrients will increase. So things like our iron is a typical one where our iron requirements significantly start to increase as pregnancy progresses. Our energy requirements. So again, I think that whole kind of old wives' tale of, oh, you're eating for two now. Our nutritional requirements don't increase in first trimester. They do increase by about 350 calories in the second trimester and about 450 calories in the third trimester. Per day. Yeah. So it is quite a lot.
That's significant.
And then again, postnatally, if breastfeeding, about 550 calories a day. I know, I'm eating all of the time. All the time. So it's just, I guess, sometimes you need that reassurance to understand that actually your body needs more. Like the placenta is an organ. It's not just this little pillowcase that your baby's being presented in. It is an organ with a blood system. You are building that and growing that every single day. And you're also trying to feed and grow a baby. Yeah. So when you think about it like that, I think you're kind of like, oh, well, actually, I do need to be increasing my portion sizes, or I might need to have a few more snacks and a big, a supper before bed. And actually, if you're doing that, there's absolutely no guilt or shame, or, sometimes I think as women, we sometimes feel like we should be maybe eating the same as what we always have been eating. And actually, what you're eating in pregnancy may look very, very different for a number of reasons. And that's okay.
And I actually wanted to talk to you then about, because I think as women, it's very rare you'd meet a woman who hasn't had issues around body image or food in their lives. And then I suppose with pregnancy comes so many body changes on the daily. What would you say to women who still have that niggling in the back of their mind, even when their body has a much bigger practical task to do?
Yeah, you could do a whole podcast just on body image and pregnancy. It's a really challenging time, I think, for women for many reasons. What I do find when I'm working with women on body image is it's often in that kind of early pregnancy stage and actually postnatally where we struggle the most.
Okay.
Because in that early pregnancy stage, you're probably feeling a bit crap. You're probably gaining a little bit of weight, as we would expect for you to do so, but you don't look pregnant yet. So you might have people kind of making some comments, which is absolutely never okay to comment on a woman's body, irrespective of if they're showing they're pregnant or not. Even though sometimes people may think that it's a compliment, it never is. But I think that's kind of a time where it can be a real struggle because your clothes maybe aren't fitting you as well. You're just not feeling great. Comments are coming in. But again, it's not like, you maybe haven't told people you're pregnant yet, or you're not showing yet. Then what I find is as we start to become and we look more pregnant and we have the bump and we kind of have that, pregnancy glow and we're feeling well, our energy levels are a bit better. Not all the time, but in a lot of cases, the body image issues maybe aren't as much of an issue. Yes, your body is changing, and I think women really struggle with that sometimes, but you're growing a baby, you're producing new life, and you're maybe feeling well, and I guess it's a little bit easier. But then what I find is the most challenging time is postnatally, where we've had the baby, we still have this absolutely crazy bounce back culture or
the
expectations exactly of where we should be, and actually your body is never going to be the same again. And I think that's not really reinforced enough for women. And also you're recovering from the biggest event probably that your physical event that your body's ever going to go through, unless you have another baby. So I think that's really where we need to try and be more compassionate to ourselves. If you have a friend going through it or whoever it may be, really just, I guess, supporting as much as possible. And then I think, I would talk to, I guess, from a practical perspective, sometimes what can help is actually just removing mirrors from the house. I know that sounds absolutely mad, but not having full length mirrors, because it's probably not a time where you feel amazing. You're tired, you're, trying to look after a baby. So actually removing those full length mirrors or putting a blanket over them or a towel over them, and making sure that you're getting underwear that fits. Yeah. That's one that I would spend a whole session talking to clients about, is getting underwear that fits, and it would be women who have, may not are pregnant or, may not be in that postnatal period, but actually we've never gone and got measured for a bra, and our bodies have changed in that time. And it might be, the big granny knickers, but that's what's comfortable for you at the moment. And it might also be then looking, if you can kind of, feasibly just go and get some clothes that actually fit your body for right now. Get rid of the jeans, put them away until you're at a stage where maybe you're feeling kind of, a bit more realistic. But go and get some jeans that are maybe a couple of sizes bigger, that are comfortable for you. If you are sitting with clothes that are digging into you, or bra straps that are digging into you, it's going to make you feel a lot worse about yourself. So they're kind of things that can help. And then also kind of little things that actually fill up your cup, like having a nice bath, doing a face mask, going and getting your hair done, things that don't have anything to do with your body image, but actually make you feel a little bit better in yourself.
Maisy has returned.
She's back in and out.
She said, let me back in.
Yeah.
Okay. And then some of the stuff that I'm seeing online, Jess, like I'm seeing in the third trimester that I should be inhaling dates and raspberry leaf tea. Is there any evidence to these?
So with kind of those novel foods and things like raspberry leaf tea, there isn't really much evidence to show that it can actually induce labour. However, we would kind of say, if you're having a cup or two now and again, it's absolutely fine, but not to be taking copious amounts of it, especially earlier on in pregnancy, in case it does induce labour. With dates probably have the most evidence around, kind of possibly. There's no kind of clear cut, like this will induce labour, this won't induce labour. But with, I guess it's a hard... But it's again kind of looking at safety and making sure that we're not doing any harm, and it kind of looks at, I guess, from dates, it's not guaranteed, but generally looking at kind of 5 to 6 dates from around 36 to 37 weeks is safe to absolutely do and potentially beneficial. Then there is another one that kind of is thrown around, I think not as much as it used to be, thankfully, but castor oil is one that I've been asked about before as well. So castor oil is actually one that may stimulate uterine contractions, but it's actually been shown to could be quite damaging and dangerous, just in regards to causing diarrhea or dehydration and possibly fetal distress. So I just wanted to pop that in there in case anybody has heard of that or been told by the granny or the mammy.
Or Instagram.
Actually. Yeah. So sometimes it's looking at, there might not be any research, but it's safe to take. It's not going to be any, it's not going to be damaging or harmful to you, but actually in the case of that, it could actually be. So it's just kind of making sure that you're kind of using what's evidence-based and maybe talking to a professional and asking about whether it is worth trying or not.
Right. Well, I'm glad I asked a professional. So Jess, I can't thank you enough for coming in and chatting to me today.
Thank you.
You brought in gorgeous little Maisy and she did so well.
Yeah, she's very vocal, but that's okay. She's happy to be here, I think.
But no, it was exactly the kind of conversation I wanted to have about kind of removing a lot of the shame and the guilt and the finger wagging, and I think you did that so well, so thank you so much for joining me today.
Thank you very much for having me.
Now, a few things that I absolutely learned from that chat. There are a few supplements that I'm going to have to race out and get. Like I was saying, I'm over 6 months pregnant now. I'd never heard of choline, wasn't really aware of the importance of omega-3. So I am popping straight to a pharmacy and picking those bits up. But I hope you learned something yourself as well. And if you want to learn more from Jess, you can follow her on Instagram. She is at willow_nutrition. Or you can go to her website, which is www.willownutrition.ie. She is a wealth of knowledge and a new friend. I'm delighted to have met her. She's an absolute angel. Now, next week on the podcast, we're going to be talking about all of the crazy changes that we see our bodies go through during pregnancy. The ones that don't make sense, the ones that baffle us, and the ones that we didn't even know happened. I actually put out a poll on Instagram and asked people what pregnancy changes baffled them the most. So I'm going to be raring to go next week, and I have a list as long as my arm myself that I want to ask the health expert I'll have on the show next week, so be sure to tune in and we'll learn all about them. Thank you so much for listening. And remember, if you are on a pregnancy journey yourself, we are 1 week closer to meeting the Baba. See you next week.